Mr. President, I rise in strong support of the Community Living Assistance Services and Supports Act, or CLASS Act, which was introduced by the late Senator Ted Kennedy. The CLASS Act would create an optional insurance program to help pay for home care and other assistance for adults who become disabled, and those choosing to participate would pay monthly premiums into an insurance trust, and after 5 years could access a cash become disabled and need assistance. Over 10 million Americans are currently in need of long-term care, and that number is expected to rise to 15 million in the next 10 years. These individuals struggle to remain independent with limited assistance and may turn to Medicaid as an insurer of last resort. In order to qualify, however, people need to go through a substantial spend-down of their assets and commit to unemployment to remain eligible. Mr. President, this is totally inefficient. Instead of ensuring that an individual can remain independent and a functional member of society, the current policy requires that to receive assistance, a person basically has to become a ward of the state. Medicaid pays for half of long-term care costs, and increased expenditures are expected to add another $44 billion each year to Medicaid over the next decade. So not only is this unsustainable, it's actually nonsensical. Mr. President, this is about as much about protecting people's dignity as it is about fiscal responsibility. Too many Americans fall on hard times, becoming disabled from an accident or illness, with no safety net to help them stay independent. Ensuring that these people have an alternative to Medicaid so that they can remain active and independent will reduce the federal deficit by $73.4 billion over 10 years and save Medicaid $1.6 billion in the first 4 years that the benefits are available. Medicaid savings will continue to grow over time as more beneficiaries utilize the CLASS Act benefits instead of Medicaid. And thanks to amendments accepted in the Senate Health, Education, Labor, and Pensions Committee, the bill language is stronger than ever. Senator Gregg, my colleague in the Budget Committee, amended the bill to require the Secretary of Health and Human Services to set premiums that are actuarially sound for a 75-year-old window and maintain sustainable enrollment and benefit structure. While some have suggested that the CLASS Act is fiscally not sound, the Gregg Amendment should put those concerns to rest. Mr. President, long-term care reform has been a cornerstone of my work in public office since my first days in the Wisconsin State Senate. I've seen how important it is to give people options so they can match the level of care and assistance to their personal needs. Pushing anyone and everyone into Medicaid or into a nursing home is a waste of potential, a waste of opportunity, and a waste of money. Medicaid and our nation's nursing homes have a critical role to play for some Americans, but for many Americans, it's simply not the right fit. The CLASS Act will ensure that taxpayer dollars are spent enrolling only those who truly need Medicaid into the program and then help others save for a time when they might need some assistance to remain independent. The CLASS Act is a critical part of this health care reform bill, and I urge my colleagues to oppose any effort to weaken or strike the program from the bill. Mr. President, I yield the floor.